Welcome back, everybody, to part 2 of our second series in Ask the Pearl. Today we are going to be talking about the pap smear and frequency of cervical cancer screening. Get started here?
Sure. So the pap smear is an interesting thing is that people often use the word pap smear to be interchangeably with a gynecologic exam or a pelvic exam, but a pap smear is really a test. It's the part of a gynecologic exam where the cervix is brushed with a little brush, and we take some cells, we put it in a little container, and it goes off to a lab, and they look at those cells as a screening test for cervical cancer, and that is what a pap smear is. People often talk about a pap smear and a pelvic exam as being the same thing, but they're not. The pap smear is a screening test for cervical cancer, and it's actually an extremely effective measure for preventing cervical cancer, which, because of the pap smear, is actually a very, very rare disease. If you get pap smears on a regular basis and you get abnormal pap smears followed up, the likelihood that you'll get cervical cancer is almost zero.
And this is an interesting point because internationally, cervical cancer is a huge problem. But a lot of that is because women internationally do not have access to health care like they do in the U.S., and it also is the result that some of the other infectious diseases that we don't see with as much frequency in the U.S., like HIV and AIDS, can also increase the susceptibility of a patient to cervical cancer. But it doesn't mean that we should ignore it, and certainly with a lot of advances in technology in the United States, things that we are going to talk about today, including the human papillomavirus, we think that understanding the pap smear and the intervals that we expect you to see your doctor is a great topic to talk about today and Ask the Pearl.
So how often should women get pap smears, and when should they get them, Rick?
Well, I think the first thing we want to start with is the age at first screening. And this is something that has been looked at over the last number of years. And while we used to recommend that women ought to get their first screening pap smear at age 18 or at the beginning of sexual activity, it's now recommended that women do not need to have a pap test until they're 21 years old.
Right. And we've changed the frequency as well. We used to get a pap smear every year. And something I used to say to my resident trainees when I was a teaching physician at Emory, which was that there's nothing about the disease of cervical cancer that has anything to do with the distance from the sun and the moon. Excuse me, the earth and the sun, not the moon, but the earth and the sun. Because a year is just an astronomical number, and that has nothing to do with cervical cancer. And what we have found out is that you don't have to get a pap smear every year. There are recommendations from a body called the ASCCP, which is the American Society for Colposcopy and Cervical Pathology, and they have done all kinds of research and found out that you don't need to get a pap smear every year, and that you can get it less frequently and still get the same benefit.
As a matter of fact, the current recommendations for getting a pap test are once every 3 years. Now, here's the caveat that's important. There's other things that we recommend that you do get evaluated more frequently. For example, a breast exam by a clinician such as Dr. Fogelson or myself, or any practitioner that's been trained in how to do a breast exam, because breast cancer is very common in women, and the best preventative tool we have is not just the mammogram, but it's a clinical breast exam. So we recommend that you do see a practitioner once a year, but you don't need to have the pap smear or the pap test every year.
Right. And furthermore, a pap smear and a pelvic exam is not the same thing. If you were seen in an emergency department, I frequently hear from patients, I had a pap smear in the emergency department. And the truth is, they don't do pap smears in emergency departments. What they had was a pelvic exam. So you really have to go to an office, whether it be a family practice office, internal medicine office, or see your gynecologist, and that's where you're going to get a pap smear.
So we're going to talk now a little bit about a virus called human papillomavirus, also known as HPV. This is very confusing for a lot of people. And the reason for that is that this particular category of viruses doesn't cause just one particular problem in the human body. As a matter of fact, the human papillomavirus can cause things as simple as a plantar wart that a lot of us have seen oftentimes in childhood on fingers and toes. But there are types of this human papillomavirus that, if left alone, they can impact the DNA deep within a cell, and they can turn off specific genes that can then allow for cancer to progress. That's a very complicated idea, but the idea that we're trying to convey is that if you contract this virus, which is a sexually transmitted virus, meaning that you need to engage in intercourse in order to contract the human papillomavirus into your cervix, that particular virus, if left alone, can lead to precancer and cancer of the cervix.
Right. It is an adage that nuns do not get cervical cancer because they're not having sex. And the truth is that cervical cancer is a sexually transmitted disease via the vector of human papillomavirus. And it's a kind of a confusing thing, is that we never used to think of cervical cancer as being sexually transmitted, but we now know that if you do not get the HPV virus, you basically cannot get cervical cancer. And so because of that, we have added onto a pap smear, which is actually looking at the cells specifically, we now also look for the virus itself, and that's called an HPV test. And we have a fairly complicated algorithm, which has given me great headaches over my career because it keeps getting more complicated, but it's an algorithm that tells us what to do with abnormal pap smears. And it now involves what do the cells look like, but also what is the results of the HPV test. And we can't get into every little permutation, and to be honest, it's gotten complicated enough that we have to always look it up, because it used to be easy, and now there's about 100 different possibilities. But what we know is that if we follow this algorithm, we can limit the amount of times we have to screen. We don't have to screen as often as we used to. We are going to eliminate almost to zero the amount of cervical cancer that is found in the screened population, and we're not going to do as many tests as we used to do.
So in a nutshell, if you come into a clinician that provides gynecologic care, they may recommend getting the pap test. They may also recommend getting an HPV test. These are sort of interchangeable in a way. The HPV test is looking for a specific type of virus. We can categorize that virus as a low-risk virus. Even though that low-risk virus can still cause warts, it's not going to cause cancer. Then there's a high-risk virus. That high-risk virus is the one that I was referring to that can have an impact in the DNA of the cervical cells. And that's the one that we want to be careful about. Now, the pap test itself is going to let us know whether or not there's already changes occurring in the cervix. And if there are, you may be recommended to come back and see an expert like Dr. Fogelson or myself or another gynecologist, and they may want to take a closer look at the cervix to see what exactly is happening. That could then lead to biopsies and potentially the need for a procedure, and we can talk about that at a later date. But the most important thing here is explaining that the pap test is a screening test. The idea of a screening test is that we don't want to let anybody with a particular disease get through the screen. And that's why we're going to have some false positives. So there's going to be patients that we have a test done, we're going to recommend that you come back and see us, and then we're going to tell you, you know what, everything's okay. That's great news. For those of you that have an abnormal test, we may need to have you come back and do some more evaluation, something that we can certainly talk about at a later date, and we're happy to answer your questions as you write into us like you did last week.
Right. So if you have any further questions, please let us know. You'll see the little bar come up here that'll tell you where you can send your questions, and or you can give us a call at the Pearl Women's Center.